I will now turn it over to my colleague, Mr. Hussein Askary, who will elaborate some of the other aspects of the Belt and Road. Thank you. You're welcome, Mr. Askary.
Thank you, Stephen. Ladies and gentlemen, Your Excellencies, I'm very happy to participate in this very successful webinar. I can say I congratulate our friends in the Pakistani Embassy, Ambassador Zahur Ahmad, and Trade Counselor, Mr. Mustafa Ghulam. I have also, I would thank all the speakers in the previous panel for enlightening us on all the potential that exists in Pakistan, but also the other speakers in this current panel. This is enormous wealth of knowledge. I'm going to talk about certain ironies, which Professor Geraci hinted at. It's that, you know, the question of the conflict between the political and the economic, because there are many ironies when it comes to the political talk, and therefore that's it's preferable for certain circles to use the political talk rather than the economic talk, because the economic talk will quickly collapse all the narratives about the Belt and Road and China. So I would just read from my presentation just to save time. I'd say there is no doubt, which is, I mean, my presentation is, as you see in the map behind me, that we have actually a global possibility for cooperation among all nations presented by the BRI. This is not a Chinese or Asian phenomena, but it could become an international cooperation framework. Now, everybody knows that the COVID-19 pandemic is the greatest threat and crisis facing world today. Reports of continued and sometimes unprecedented spread of the virus, such as in India and Brazil, for example, and the incredible loss of life and livelihood in many parts of the world are everywhere to be seen by people. However, a parallel and unfortunate development is escalating in the form of tension between the United States, NATO, EU alliance with both Russia and China, and it is reaching a very dangerous level, as my colleague Stephen explained. What this shows is that the list of priorities for policymakers in many powerful nations are somehow confused and misguided. Many nations are left fighting alone against the pandemic with no real resources. This creates new strains of the virus that can come back and hit even the nations that have managed to control it or are mass vaccinating. These vaccines might become inefficient in the face of new strains. So, as the saying goes, nobody is safe before everybody is safe. Vaccine nationalism and chaotic panic-driven measures are making an international joint effort to fight the virus and secure the world against it very hard task to accomplish. At the same time, a military escalation is brewing in the East Front between NATO and Russia, and between the United States and its allies against China. Now, I would just the hypothetical question, if we had aliens coming from a distant galaxy to Earth in last year, 2020, and observed that the pandemic had caused the global economy to shrink by 4.4% in terms of gross domestic product. The number of people in extreme food insecurity reaching 350 million people, and supply chains collapsing. But those aliens see at the same time that world governments spending 2.4% of the global GDP on military expenditure. Now, what would they think about humans? Of course, they would say that we are becoming insane. The Stockholm International Peace Research Institute, CPEC, just published a report. I'm sharing just want to share with you my slides. just trying to get the slideshow. All right, I guess you can see it now. The Stockholm International Peace Research Institute, CPRI, reported in its latest study, published just last week, that in 2020, military expenditure reached a historical level close to $2 trillion US. Of course, the United States is leading the pack with $790 billion on military spending, but other nations, including China and other EU and NATO countries, are also spending. Now, imagine what we can do with $2 trillion a year of invested in transport, water, power, healthcare, education, and scientific research globally. On April 22, and I'm going to go through a few of the ironies of the political situation, then we'll go to the economic aspect of things. On April 22, the US Senate Foreign Relations Committee passed a bipartisan resolution called the Strategic Competition Act of 2021. That's, of course, competing with China's Belt and Road Initiative. It proposes to allocate $300 million annually to do what? Build railways, build power plants, hospitals, and schools in Africa and Asia? No. Much of this money will be spent to finance so-called independent media and third-party civil organizations, that is in countries around the world, to discredit the Belt and Road Initiative. The legislation also calls on the Assistant Secretary of State for Democracy, Human Rights, and Labor to work with the US Agency for International Development, USAID, to support and train journalists in other countries on investigative techniques necessary to ensure public accountability related to the Belt and Road Initiative. So they pay and train people in other countries to create fake news about the BRI, such as the discredited death trap narrative. Now, if you want to beat China and the Belt and Road Initiative, shouldn't you be competing to build better and cheaper railways in Africa, or more efficient power plants and water management systems, or build better schools and hospitals than the Chinese do? Last year, the Chinese President Xi Jinping said that China and the United States should be competing like two sprinters on the track, not like two boxers in a ring, trying to undermine each other. Now, the US and the EU have made many initiatives to beat the BRI. That's the declared intention, but none of them materialized, and some of them have even become comic in nature. We had first the EU-Asia Connectivity Initiative in 2018. Now, that didn't really end so well. And also, it turned out that this EU-Asia Connectivity Strategy is simply a two-page slideshow, as you can see here. This is the first page. Now, what is comic about this EU strategy for connectivity with Asia, it ignored the existence of a tiny little banana republic in Asia called China. There is no mention of China in this strategy at all. Probably because they think that China is not such a significant economic power, or there's no understanding of what is going on, or that this really the EU-China, the EU-Asia connectivity strategy is not a strategy. Now, the Swedish Institute for European Studies, Policy Studies, spent 80 pages. They wrote a report with two authors, Svante Cornell and Niklas Svanström. They tried to figure out the content in these 2 pages of the EU strategy to finally come out with the conclusion that the best strategy for the EU would be geopolitical, i.e. trying to manipulate Russia and China to work against each other in Asia. Now, of course, that's not going to happen. And that's not really the right strategy to do things in Asia. Now, we had also the Japan, India, just another example, so-called Japan-India backed Asia-Africa Growth Corridor in 2018. That is that China and India jointly will invest in infrastructure in Africa. Now, what this whole discussion ended up becoming is just a website that has not been updated since January 2018. Now, the Trump administration also had its Prosper Africa, which it launched in 2018 by then National Security Advisor John Bolton. The initiative, he said, Bolton, would foster US expand Africa's middle class, and enhance business climate across the region. He also said it would help to counter predatory financial and political efforts by Russia and China in Africa. Now, the Trump administration did not put its money where its mouth was, and the initiative is gone now. The Biden administration is merely warning African nations against working with the non-transparent China. Well, thank you for the advice. That's all these initiatives can offer Africa and the rest of the world, which is just simply words. It's not backed by any serious projects, financing, real construction of these projects. Now, what is wrong with these initiatives is that, and why they fail, it's because first, they are not connected to the reality of the world and what people around the world need and aspire to achieve. Second, they are merely designated as a political and media gimmick to encounter China and the Belt and Road Initiative without backing them with any substantial investments or serious alternatives. Therefore, the more the opposition to the BRI and China grows among politicians, think tanks, and media in the West who try to tarnish China and the BRI, the more nations are attracted to joining it. That's a bit ironical, isn't it? Up to now, 140 nations have joined the BRI, many of them after 2017. 140 nations out of 190 is not a bad certificate of success for the BRI. Now, the opposition to China and the BRI is generally based on the notion of geopolitics, a zero-sum game, where the winner takes it all and the loser is destroyed. Win-win cooperation is considered naive and misleading. It is this geopolitical thinking that has brought us to the brink of not only a new Cold War in the world, but a potential hot war, in which there will be no winners because civilization itself will be erased. Now we go to the second part, which is more interesting for us and for this webinar, which is our serious business. Now, if we manage to brush aside all these false and inhuman notions of the law of the jungle and deal with each other as humans with universal rights and aspirations, with equality among nations, there is a way out of this crisis. Our Belt and Road Institute in Sweden has worked tirelessly and will continue to do so to explain why it is more beneficial for Sweden, Europe, and the United States to work together with China and even Russia than work against them. We also have explained that the Belt and Road Initiative is a suitable platform for the major powers to get together to deal with the most pressing matters of the world, including the achievement of the UN Sustainable Development Goals. We have produced and will continue to produce podcasts, reports, and convene webinars and hopefully seminars soon when the restrictions are lifted to bring together experts and leaders to discuss these matters. In our podcast series so far, we dealt with many matters that are worthwhile to consider in the context of the East-West cooperation, which we are proposing. And just go back to my slideshow. We started our podcast series with the discussion about the comprehensive agreement on investment between China and the EU. We had a discussion on Sri Lanka, another podcast. We had the Maritime Silk Road discussion with Professor Griffiths from Holland. We had also a very fascinating discussion about the rail freight transport with a representative of the rail freight in Holland, Mrs. Huilin Shi. We have also a discussion about the Space Silk Road with a historian of space exploration. And this also shows in a fantastic way why nations have to, it's not like a choice, they have to work in space together if humanity is going to progress in that field. And by the way, China is sending to establish its space station in this coming week, and it will become a replacement somehow of the International Space Station, which will be decommissioned this year. And China will be probably the host for all kinds of astronauts from the United States, Russia, Europe, and other nations. We also had a very interesting webinar on debunking the China debt trap, which is now discredited. We had on the Green Belt and Road with the former Environment Minister of Norway, Mr. Erik Solheim. We had a webinar on, or a podcast on the Health Silk Road, which I will stop here to conclude my presentation because there are many interesting things, and Mr. Henry Tillman have discussed these matters with the real numbers. But the Health Silk Road is very important to understand certain aspects of the Belt and Road Initiative. The Health Silk Road, of course, was an initiative in 2017, which I will come to soon. But I just want to say that, as everybody knows, that China managed in record time last year, as Mr. Henry Tillman said, in about 2 months to control the COVID-19 pandemic at home, and then quickly mobilize to help other nations with the materials and medicines and now vaccines. Now, China's ability to manage such phenomenal achievement hinges on 2 aspects. 1, its organizational socio-political skills, and 2, infrastructural and industrial capacity. Now, I will deal with the latter one on the infrastructure industry, since different countries have different political, social, and cultural and historical structures that cannot be generalized or copied by other nations. The fact that there is a direct correlation between the availability of modern and solid infrastructure, that's transport, water, power, telecommunications, and the ability to provide healthcare for the population in any country was emphasized in a detailed study published by the Asian Infrastructure Investment Bank, AIIB, in March 2020, and entitled The Impact of the Coronavirus, COVID-19 and its implications for infrastructure priorities. Now, the AIIB researchers correctly pointed to the importance of infrastructure for providing a good level of healthcare for populations, urging to redefine the priorities for infrastructure development projects by governments. It also pledged to support such priorities financially. The AIIB, which is one of the key global financial institutions that emerged in the wake of the Belt and Road Initiative and is based in Beijing with a capital of $100 billion, has up to now 100 member nations, including many European countries and Sweden, of course. The report states that this, quote, the disruption brought about by the COVID-19 also highlight the importance of sustainable and resilient infrastructure. Firstly, developing economies will need to increase investments in healthcare and public health infrastructure. This is especially crucial in the context of megatrends such as urbanization and increased trade connectivity. Without proper public health infrastructure such as clean water and sanitation, developing economies will remain vulnerable to such outbreaks. A country's readiness to cope with epidemics is correlated with its quality of infrastructure. Infrastructure development is a key part of health security and epidemic preparedness, end of quote. It also noted in a press release published on March 25 that recognizing that countries with fragile infrastructure have less capacity to handle health crises, the AIIB is working to scale up infrastructure investment, including in public health, healthcare, and for information and communication technologies, to better serve members impacted by the COVID-19. Now, this is not a new idea. This was the norm in the post-World War II era of reconstruction in many parts of the world, especially in Europe and the United States. In the United States, a model based on the congressional law called the Hill-Burton Free and Reduced Cost Act in 1964 stipulated that the standard for a modern public healthcare system should be the provision of 4.5 hospital beds per 1,000 people. Today, the beds available per 1,000 people in the United States have fallen to 2.9, according to the World Bank. Russia stands at 8.2 beds per 1,000 and China at 4.2 beds. However, what the World Bank list also shows is the disastrous conditions in many countries in the world, especially in Africa, where public health facilities are way below anything that can cope with the serious outbreak of the corona pandemic or any other pandemic, epidemic or pandemic. Now, here is a sample of hospital beds available in African countries. As we said, the standard is 4.5 beds per 1,000 people. So you can compare. We added a column for electricity consumption in kilowatt hour per person per year in these countries for purpose of determining the requirements for having such hospital availability later. The reason should be obvious, since hospitals cannot exist in a void without electricity, nor without clean water, transport, telecommunications, or skilled workforce. Of course, you cannot have any real healthcare. Now, to compare these numbers of the available electricity, in Sweden, for example, we have the number is 13,000 kilowatt hour compared to these African countries. To bring Africa to the same Hill-Burton standard of public healthcare, it can be estimated that the continent would need at least 15,000 new modern hospitals constructed, containing 4 million new hospital beds. Now, to understand the physical requirements for building a modern healthcare system, we take one well-documented example. That's the US, from the US Energy Information Administration, which was it issued a report in 2007, where it discusses how much electricity, power, and clean water you need to have modern hospitals. And they studied the 3,000 biggest hospitals in the United States. And without going through all the numbers, what this shows that for Africa, that for the 15,000 new African hospitals, they would require approximately 25,000 megawatts of new power, electric power generated, and 3.5 billion cubic meters of clean water just for the hospitals. Now, the reason I'm going through all these details is to make it clear that providing healthcare for African continent is not about donating 100 Swedish kroner or a US dollar every month to some NGO. You cannot have modern healthcare without infrastructure, electricity, clean water, transport, and education. So that brings us to this whole idea of the Health Silk Road. As you know, President Xi Jinping announced the Belt and Road in 2013, but in 2015, the Chinese Development and Reform Commission issued the Vision and Action on Jointly Building Belt and Road, in which it very clearly discusses the importance of building a healthy Silk Road and investment in these roads. Now, I will just, to go to the conclusion, there was a very important conference in 2017, and in which the World Health Organization signed the Belt and Road Memorandum with China. In that conference, which was called Belt and Road High-Level Meeting for Health Cooperation towards a Health Silk Road, that was the official creation of the Health Silk Road. It was in August 18, 2017. And at the end of that conference, 64 nations signed the Health Silk Road communique. Now, in his address to the conference, the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus said, quote, "As you know, the world faces increasing and more complex epidemics, pandemics, and disasters. Not only are these events more likely to occur, they are also likely to have a bigger impact on human health, the social fabric, security, and the economy." He continued to say that President Xi's proposal for a health Silk Road, which strengthens and renews ancient links between cultures and peoples with health at its core, is indeed visionary. Now, Tedros said, he pointed to the important point I'm trying to raise, is the connection between the Belt and Road and the UN Sustainable Development Goal number 3, which is about healthcare. The WHO director said the Belt and Road Initiative contains the fundamentals to achieve universal health coverage. Infrastructure, that's infrastructure, access to medicines, human resources, and a platform to share experience and promote best practices. China has much to teach us about these issues. It is a world leader in disease surveillance and outbreak control and was one of the first countries to step in during the Ebola outbreak, end of quote. In conclusion, Tedros said, we should build upon these experiences. Let us, the health leaders of the 60 countries gathered here and public health partners, build a healthy Silk Road together. Now, in conclusion, I would like to say today, more urgently than ever, the Health Silk Road and the BRI are offering a platform of cooperation between all nations. The BRI should no longer be considered a Chinese project. It is an all-inclusive mode of peaceful cooperation among all nations. The world does not need more weapons. It does not need more fake news and mass media and think tanks. It needs serious efforts to achieve peace and understanding among nations through economic cooperation and economic development. Thank you for your patience. That's what I had to say.